In this morning's Health Watch, the diabetes epidemic. Over the last 3 decades, the number of diabetes cases has increased, listen to this, 136%, now totaling nearly 24 million Americans. Here to discuss the physical and financial toll of the disease is Dr. Andrew Sussman, Associate Chief Medical Officer of CVS Caremark. Good morning, sir.
Good morning.
Let's first differentiate about which diabetes we're talking about here, type which.
Type 1 diabetes patients have an inadequate amount of insulin produced by their bodies. But most patients have type 2, where they both lack enough insulin and insulin is somewhat ineffective due to their body.
All right. Let's talk about some of the risk factors for diabetes and people that, especially as they go on in life, there are certain markers they really need to pay attention to make sure that because this is an avoidable disease in many, many cases. First, what about family history? How important is that?
Yeah, family history is very important, as is age. Patients over 55 are at higher risk, and patients from certain population groups, such as African Americans, Hispanic Americans. But really, the problem that's become the greatest is obesity. That is becoming the most significant risk factor.
And we're talking about as many as 24 million Americans. And we've done segments about this, it seems like a lot, especially over the last 3 or 4 years. And this is not just affecting people of a certain age, it's reaching down younger and younger and younger all the time.
Yes, even children are developing diabetes at an alarming rate. And again, it's due to lifestyle changes and obesity. Beyond the 24 million Americans you mentioned, there are another 57 million that have a slightly elevated blood sugar and are pre-diabetic and at risk for developing the disease.
That is amazing. What are the most common symptoms? How, if you were in that risk group and just look through some of those risk factors, what should you be looking for in terms of symptoms?
Yeah, frequent thirst, frequent urination, tingling in the hands and feet, blurry vision, overall fatigue. Some patients have very mild symptoms. Some have no symptoms at all. So if you have a concern, talk to your healthcare provider about getting screened. Early treatment can help patients feel better, and studies have shown help prevent some of the long-term complications of the disease, or at least delay them.
Right. Talk a little bit about the management of this, because you hear people say they struggle with management of the disease. They tend not to do enough in terms of the insulin and what have you. How important and why is it so important to manage your diabetes well?
Yeah, management is really a lifelong process, and it starts with a healthy diet and regular exercise. In fact, even a 10-pound weight loss can make a big difference. Many patients require daily medication and regular blood testing at home for their sugars, and a test known as a hemoglobin A1C test. It measures blood sugar over a 2 or 3 month period. It's a little bit like a baseball player's batting average for the season.
So you have a line to follow then.
Yeah, as opposed to the results from a single baseball game.
If in the average life of a diabetes patient, do we know what it ends up costing? I mean, dollars and cents wise?
Yeah, patients with diabetes tend to spend twice as much on their health care due to the need for regular medications, testing supplies, and other items. That's why many organizations, such as CVS, are working to develop programs to help hold down costs. And it's a good idea to talk to your health care provider about whether generic medications may be right for you. They tend to be less expensive and are often equally effective for treatment.
Dr. Andrew Sussman, thank you very much for your time.
A lot happens early on The Early Show, weekday mornings on CBS.